Hello everybody, Dr. Parsa Karimi coming at you from our Plainview location. We also have an office in Amityville, Long Island. Today we're going to talk about the second joint in our series of how to prevent surgery with physical therapy despite what your MRIs or x-rays might show. So we're going to talk about the hip today. Many patients have come in and they say, I did a lot of recent activity, my hip started bothering me, I went to the doctor, the x-ray showed bone-on-bone arthritis, osteoarthritis, so I was scheduled for a hip replacement, and now I'm going to have a hip replacement in a few weeks. The doctor just wanted me to start some physical therapy. Fortunately for those patients, they were given that option to start physical therapy prior to having surgery, and within a few weeks we found out, well, actually on the first day we found out that it was a muscular issue that was causing most of their pain that led them to go see the doctor, and within a few weeks the pain was gone and they canceled their surgeries. Now this is not an anomaly, this is not a thing that sometimes happens. Many times patients come in and we see patients that are given a diagnosis by the doctor of something that is structural, meaning osteoarthritis, a meniscus tear, bone spurs, whatever it is. Those structural abnormalities are blamed for why the person has pain. And what I've seen is a majority of the times, luckily for me, luckily for physical therapy and mostly for the patients that come in, the majority of times it's just muscle. Muscles, we have like 650 muscles in our body. And if a muscle is strained, good luck trying to use it. It's going to give you a lot of pain. It's going to stop you in your tracks. It's going to make you see stars. It's really, really painful when you try to use a strained muscle. And unless you know, well, what activities use what muscles, I mean, we learn that during kinesiology, during physical therapy classes that we take. We are the movement experts. We know exactly what muscles you use to perform any and all functional activities. So when a person comes in and says, I have pain with this, this, and this, we know, okay, you need these muscle groups, and these muscle groups. Those muscle groups are being stretched, these muscle groups are being used, and the most amount of tension is on these muscle groups. So we can really figure out, just by speaking to somebody, and learn about, okay, why do you have pain with what activities? Okay, it's probably this muscle group. And luckily for these patients that have come in with their hip pain, we have found that most of the time it's just a muscle strain that's causing most of their pain. You can see like the confusion on patients' faces sometimes. They're like, wait, but the x-ray showed arthritis, or the MRI showed a tear. And you say, yes, you have those things, but that's not why you have pain. And oftentimes patients will interrupt, like, no, but the doctor said. And I say, listen to what I'm telling you. You have those things. I'm not saying that the MRI is wrong. I'm not saying that the x-ray is wrong. I'm saying that you have it, but that's not why you have pain. It's really hard to imagine, but you right now, whoever's watching this, you probably have, or you possibly have, herniated discs, bulging discs, a little bit of stenosis in your spine, arthritis. You might even have a little rotator cuff tear, a little bit, a meniscus tear. You might have all these things, and it might not cause you any discomfort whatsoever. You would bet that, you know what, no, my shoulder's fine, my spine is fine. And then you get your MRI back and you find out, oh no, it's not fine. It's not perfect, but it's fine. You're functioning. You're okay. It's not giving you any pain. Imagine if all those things that you found in your body, you decided to go have surgery for, despite the fact that it gives you no pain whatsoever. Why would you do that? Nobody would ever do that. And that's why every single time a person comes in, and they either come in for their knee or their hip, and I say, you still have the arthritis. Do you still want to go have the surgery after their physical therapy is done, after their pain is completely gone because it was muscular? I say, you still have that osteoarthritis. Do you want to go have a knee replacement? And they say, absolutely not. In fact, one of the questions on our licensing exam was, when does a patient decide, or what is the one factor that makes a patient decide whether they want to have a joint replacement? Is it pain? Is it the doctor told them? Is it the x-ray? Is it the physical therapist told them, or their strength is low? No, it's pain. When they literally can't take the pain anymore, that's when they go have surgery. So physical therapy can take your pain away and you don't have it anymore, but the x-rays still show bone on bone, which, by the way, is just a subjective explanation as to what they see. It's just, if I look at a picture and you look at a picture and I say it's this and you say it's that, it's two different opinions. So just because someone just says, oh, you have bone on bone, sometimes, unfortunately, it's like a selling point people tell patients, and those same patients come in here and I move their joints around and I go, this joint is moving freely. There's no grinding of bone on bone here. But patients kind of cling on to that diagnosis and they say, the doctor said I have bone on bone. So before we jump into any kind of surgeries, always come in and try physical therapy first. And many times patients come in and they say, I have osteoarthritis, a hip strain, and I find out, they have osteoarthritis and bone on bone. And then we do some simple muscle testing. We find out, no, it might be a glute medius, the muscles in the back, the deep muscle in your buttock called the piriformis, the muscle in the front of your hip called the rectus femoris or the sartorius, or psoas muscle deep in your belly that goes down to the inside of your femur. All those muscles could be involved in causing you pain, and oftentimes it is just that. It's just a muscle strain. And these patients have gone to many doctors, pain management, seen doctor after doctor, been told by doctors, a couple in a row, yeah, you need a hip replacement. Then they come see us and we find out, no, it's just a muscle strain, and we resolve it, and their pain is gone, they're feeling better. Another reason why people might come in, they say they have a labral tear, they got that deep pain in the groin, and they may have that, and the MRI does show a tear, but we find out that, again, the reason why they have most of their pain is any of those muscles I just described to you that are causing the discomfort in their hip, and that's why they're having limitations, that's why they're having to go see the doctor. So many times, again, remember, just because you get told that you have severe osteoarthritis or you have a tear, always try physical therapy first. And I always say this, if you've gone to physical therapy and your physical therapy treatments involve you getting a hot pack, maybe getting those electrodes to stim, maybe getting some ultrasound, all three of those things right then and there are a waste of time. That's why insurance companies don't pay for them. That's why, because they know that it's a waste of time. It makes the person feel like they're getting something, but it's still on their own just a waste of time. And then if you continue with, hey, ride the bike for a little bit, I'm going to show you some stretches to do, maybe the therapist puts their hands on your hips and kind of moves your hip around a little bit, and that's about it, it's a waste of time. So you want to get some real physical therapy. And what is real physical therapy? Somebody actually they actually put their hands on you and they do a deep tissue massage. Remember what I said, much of why people come in here with pain, actually in our facility, it's always muscle. 99.5% of the patients that come in here get a deep tissue massage. The ones that don't are the ones that are here that are strictly here just because they're weak, they can't function because they're so weak, so we just build them back up with all the strengthening equipment that you see around you. But a majority of the patients that come in here get some sort of deep tissue myofascial release. Myo is muscle, fascial is the fascia that surrounds the muscle, the connective tissue. If you've ever cut chicken or steak, you see that white sheathy tissue that's around the muscle, the steak, that's fascia. And when it becomes inflamed, the muscle and the fascia become inflamed, it all gets restricted, and you start getting metabolic waste and adhesions built up into that, and that's what the knot is. When people say, oh, you have a lot of knots, that's what they're talking about. The deep tissue is when you press into deep, past the skin, into the muscle, and you break up those adhesions, you break up those metabolic waste deposits that are in there. That's why they always tell you after a massage to do what? Drink a lot of water, because your lymphatic system comes in, drains all that garbage out of what we just released, myofascial release. We just released into your bloodstream, dumps it into your bladder, you drink a lot of water, and you get it out of your system. That's why they tell you to drink a lot of water after a deep tissue massage especially. A nice, Swedish massage, you're really not breaking up much, maybe a little bit below the skin, but the deep tissue massage that we do, and it's uncomfortable, but it's tolerable, but boy, is it, you feel like you got something done. You really feel like it's rewarding. You get up and you go, oh my God, it's so much looser, and especially at the hip, you could squat down easier, you could stand up easier, you could walk easier, the leg doesn't feel as heavy, it comes along in your gait cycle, your walking patterns a little bit better. So it's so much better to get the deep tissue massage. So that's first and foremost what we do with our patients. And then we'll stretch out the muscles that are tight, whatever is tight, we do a deep stretch to it to get that flexibility back, elongate those muscle fibers, and then we find out, okay, what muscle groups are weak, let's strengthen them. If a muscle group is inflamed, we'll work the opposite muscle just to help calm down the muscle that's inflamed. But every single time you come in, we'll evaluate to see, are the exercises still appropriate? Do we need to change? Do we need to advance? Everything we can to get the one affected limb, let's say it was your left hip, to be as strong as your right hip, and then we can get you back to two-legged exercises where they're both the same strength. We've known that because we've tested it. And once you're walking back to normal, then we can get you into higher level functioning exercises, and voila, you're better than you were before you even hurt yourself. You're stronger than you were before you ever even hurt yourself. And then we tell you about how you can keep yourself going, where you go to the gym, you keep strengthening, and to help prevent this kind of stuff from happening again. Because most of the time when patients come in, it's because there was some muscle imbalance, there was some weakness. The majority of the patients that come in here do not exercise on a regular basis. They're very sedentary, and they think that, you know, oh, I walk. Well, walking's not enough. Walking's not enough, especially if you're over the age of 50, 60 years old. Walking is not enough. I have another video where I say, seniors, you must lift weights. Okay, I'm not talking about powerhouse, you know, Arnold Schwarzenegger bodybuilding type stuff. Just go to the gym, put the weight in the machine, put the pin in the machine, start lifting some weights, have a little notebook with you, write down what you need to do in order to get yourself stronger, and every week start building up some strength. So that's what you need to do. In terms of the hip though, there are so many things that people could have surgery for. They have surgery for sciatica, they have, you know, lumbar spine or lower back surgery, and we find out that it's just sciatica, and sciatica comes from the buttock, a muscle deep inside the butt that is the piriformis muscle. The piriformis muscle is like this, the sciatic nerve is like this, literally as thick as your thumb, and it sits on top of it. Once this muscle is inflamed, it compresses down on the nerve, shoots pain down the entire back of the leg, the entire lower leg, and that's why people have a majority of the pain into their lower legs. So sciatica is another reason why people have pain, another reason why they might, God forbid, have surgery on their lumbar spine, when all it is a butt massage. Basically, you're digging in deep into the butt muscle, and patients say, that's the spot, oh my God, that's the spot. We get in there, we massage it, we stretch it, do some exercises, you're done. I'm sorry to oversimplify this for you, but it is just massage, stretch, exercise, those three things. But it's a combo of what you need to do, and that's why the evaluation is so important. So if you have hip pain, if it's bothering you, if it's not, you know, the bone's not sticking out of your skin and you're not bleeding to death, there's no reason to jump into surgery. With the direct access law, unless you have Medicare, unless you have no fault or workers' compensation, you do not need a prescription to come in. Pick up the phone, give us a call. Our website is www.pklpt.com. Our phone numbers, our hours, our locations are there. Again, we're in Amityville, we're in Plainview. Give us a call, come on in, we'll set you up, we'll find out exactly what's going on, and we'll get you on your way. Again, the hip, just like the knee, many times these diagnoses come back and they're structural deficiencies that have zero to do with why you have pain. And once we take the reason why you have pain, also known as a muscle strain, away, then the pain is gone, and you still have the degenerative joint disease or the arthritis, but it's not going to lead you to go get a hip replacement or a knee replacement. So give us a call anytime, and like I said, I'll evaluate you. I have other therapists in Amityville, Eddie, that can evaluate you, and we'll get you on your way. Again, www.pklpt.com.